This is a lecture on Parkinson's disease. Parkinson's disease is a degenerative disorder of the basal ganglia involving the nigrostriatal pathway, which produces abnormal movement called Parkinsonism. The patho in the nutshell for Parkinson's disease is that it affects the brain sensors that control and regulate movement. Neurons in the substantia nigra, the corpus striatum, in the midbrain degenerate and become deficient in production and storage of neurotransmitter dopamine. When dopamine levels that inhibit motor activity deplete, acetylcholine is not inhibited, allowing increased excitation that is the basis for Parkinson's disease. So you have a loss of dopaminergic neurons in the substantia nigra. The disease usually begins in the 50s and 60s but can occur before 40. The prevalence increases to 4 to 5% in those persons older than age 85. In terms of etiology, Parkinson's disease can be idiopathic, meaning that the precise cause can be unknown. Most cases of idiopathic Parkinson's disease are believed to be due to a combination of genetic and environmental factors. Aging may predispose one to developing the condition due to the aging process, causing the nigrostriatal pathway to be more susceptible to being damaged by viruses or toxins. Parkinsonism can develop also as a post-encephalitic syndrome, a side effect of therapy with antipsychotic drugs that block dopamine receptors, as a toxic chemical agent, or as an outcome of severe poison monoxide poisoning. Symptoms of Parkinsonism also may accompany conditions such as cerebrovascular disease, brain tumors, repeated head trauma, or degenerative neurologic diseases that structurally damage the nigrostriatal pathway. Drug-induced Parkinsonism can follow administration of antipsychotic drugs in high doses, for example, phenothiazines or butorphanones. Environmental risk factors associated with the development of Parkinson's disease include use of pesticides, living in a rural environment, consumption of well water, and proximity to industrial plants or quarries. In terms of signs and symptoms, there are three cardinal signs of Parkinson's disease, and they are resting tremor, rigidity, and bradykinesia. Of these cardinal features, two of the three are required to make the clinical diagnosis. Postural instability or balance dysfunction is the fourth cardinal sign, but it starts late in the disease, usually after 8 years or more. With tremor, the symptoms are rhythmic. They alternate with flexion and contraction kinds of movements, 4 to 6 beats per minute, that resemble the motion of rolling a pill between the thumb and forefinger. The tremor usually is unilateral. It occurs when the limb is supported at rest and disappears with movement in sleep. The tremor eventually progresses to involve both sides of the body. In terms of the rigidity, rigidity is defined as resistance to movement of both flexors and extensors throughout the full range of motion. They're most evident during passive joint movement and involves jerking or cogwheel type of rattache-like movement that requires considerable energy to perform. Flexion contractions may develop as a result of the rigidity. As with tremor, rigidity usually begins unilaterally but progresses to involve both sides of the body. There's also bradykinesia, which refers to the slowness of movement, but also includes a paucity of spontaneous movements in decreased amplitude of movement. Bradykinesia is also expressed as micrographia, small handwriting, hypomimia, decreased facial expression, decreased blink rate, and hypophonia, soft speech. There's postural instability that refers to the imbalance and loss of the writing reflexes. Its emergence is an important milestone because it is poorly amenable to treatment, and it's a common source of disability in the late disease. Patients may experience freezing when they begin to walk, so that's called a start hesitation, during turning or while crossing a threshold, and such as going through a doorway. Dementia generally occurs late in Parkinson's disease and affects 15 to 30% of patients. Their short-term memory and their visual spatial function may be impaired, but aphasia is not present. There's cognitive dysfunction within a year of onset of motor features, and that suggests a diagnosis of Lewy body disease, a disease closely related to Parkinson's disease and marked by the presence of cortical Lewy bodies. This concludes the lecture on Parkinson's disease. If having questions, please contact me at halef@hawaii.edu.